I'm Dr. Puneet Khanna. I'm head of Respiratory Medicine at Manipal Hospital Dwarka. Today I'm going to talk about COPD or Chronic Obstructive Pulmonary Disease. It's a very common chronic disease of the lungs and the airways that has affected almost all the countries all over the world. In fact, it is the only chronic disease that has been increasing in prevalence and its incidence throughout the world. And it is estimated that in another 10 years or maybe 15 years from now, it will become the most common cause of death all over the world. COPD primarily happens because of bad environment and bad air that we breathe. In general sense, it means that the lungs are filled with mucus and they get destroyed, and it becomes very difficult for a person to breathe in oxygen and expel out carbon dioxide. The most common cause of COPD all across the world is smoking, particularly tobacco smoking. But the other causes include pollution, environmental, industrial pollution, fumes, burning of crops, and in general exposure to biofuel exposure, or what we call wood exposure. There are certain patients who are involved in certain occupations which make them more likely to have COPD. It has been seen that COPD occurs over a period of time, and unfortunately this is a disease which starts from early life, in childhood and in young age. But the most severe effects of this disease is seen mainly in the later years, maybe after 40 years or 50 years of exposure of these substances to lung. And the injury then becomes permanent. It is said that COPD is an irreversible disease because it causes permanent damage to the lung, and it is often progressive because once the patient starts getting injury to their lung, it often progresses. What we can do to stop this disease is, first of all, resist smoking actively and passively both. In addition to this, we should keep our environment clean. So pollution as such is the biggest contributor, so that has to be avoided. Both vehicular pollution as well as indoor pollution in the form of chemicals or fumes exposure. Exposure to biofuel masses, particularly petrol exposure or burning woods exposure, needs to be avoided. That is the reason many women in the rural household, they get exposed to these chula smoke and they get affected with COPD. So COPD can be managed in many ways. The first and foremost is avoidance of risk factors which are resisting from smoking both actively as well as passively. Improvement in the environment in general by decreasing pollution and avoiding exposure to fumes and indoor pollution also goes a long way in preventing this disease. Then there are certain medications which are called bronchodilators and anti-inflammatory medication in the form of inhalers or rotacaps or nebulizers or in the form of tablets, which open up the lung and prevent further injury to the lung. In advanced cases, often oxygen is required, sometimes lifetime, to improve the lung function, and these patients may require additional support in the ICU in their severe exacerbations or when they have severe disease. Finally, there are certain candidates who can go for surgery, or what we call lung volume reduction surgery, where the affected portion of the lung is removed and their breathing quality improves. But most important factor to consider in prevention and treatment of COPD is the prevention of exposure to smoking and pollution. As COPD is mainly a disease of elderly or the adult age group, it is also very important to prevent these patients from getting repeated infections. So these patients should always get vaccination, particularly pneumonia vaccine, influenza vaccine, herpes zoster vaccine, and tetanus vaccine, so that their lungs do not get affected by repeated infections. And if we can prevent infections, we can also prevent hospitalization. Thank you very much.